From Flourish DX, this is the Psych Health and Safety Canada podcast, with workplace mental health becoming a priority for businesses who want to retain staff and prevent burnout. This is the source of information for creating sustainable and psychologically healthy workplaces in Canada.
Welcome to the Psych Health and Safety Canada podcast. And today my guest is Merv Gilbert. Merv and I have been collaborating together for over a decade now. And he's been immersed in the field of psychological health and safety. So welcome, Merv. And I'm wondering if we can start with you talking about the first time you heard the phrase psychological health and safety, and what was that turning point for you?
Well, I think there were two things. I mean, I guess the answer to your question, Marianne, it's great to be talking to you. First time I heard psychological health and safety, I think, was probably, around time the concession conference and so on, when we were actually starting to work on language. And we can talk about that later. But the first time I sort of became aware of it as an issue was actually when I was head of the Department of Psychology at Vancouver Hospital many years ago and so on. And in fact, two of my colleagues went off work. They were performance issues. They weren't getting reports done. Reports are the bane of a psychologist's business. And there were concerns. Other people were, I won't say covering for them, but picking up a load and so on. And these folks were struggling. In the end, they both went off work. I didn't know the diagnosis per se, but I'm sure it was some combination, something called depression, anxiety, as is the case may be. I was manager. I think I was supportive. I did what I could. We modified workload and so on. I think the health nurses, the OHNs, the hospital were helpful. I don't know that we did anything wrong, but both those individuals, PhD trained psychologists, went off work and to my knowledge never returned. And to some extent, I think that was what really sparked, like, there's something here that we need to pay attention to. And there was very, very little attention in either the scientific literature or frankly, the, if you will, gray or popular literature to this notion of mental health in the workplace. And I guess at that time, along with colleagues, I was involved with CARMA, the Center for Applied Research, Mental Health and Addictions, and with some colleagues there. We got a bit of funding. We did a report way back when called Depression and Work Function, talking about the impact of, obviously, depression on various aspects of cognitive and physical and emotional functioning, and how that impacts the work and how that impacts colleagues. Then I did some digging, and we did some digging as part of this work and discovered there was work going on in the UK. The UK had their stress standards. There was work going on in Copenhagen, in Europe in many cases, so on. So there was a literature out there talking sometimes about psychological health, mental health in a workplace context. So I think it kind of emerged. But as I said, when I think we collectively, we codified the language to some degree. And I do think one of the things I'm most pleased with over the years is that psychological health and safety has stuck and is referred to in many contexts. And I'm going to make a distinction here, and I think it's an important one. It's one of my favorite rants. Psychological health is not just the same as mental health. Mental health, for better or worse, has been co-opted to some degree, in my opinion, and often used, unfortunately, when there's a latest tragedy and so on, is used in the context of folks with serious and persistent mental illness, which is a very important social issue and so on, but it's not quite the same thing. It's not the best label necessarily for folks who are struggling in the workplace. Psychological health covers a continuum of functioning. I guess I'll use symptoms, signs and symptoms and so on, impacts on behavior and relationships, but it also includes positive functioning, vitality, doing well. So psychological health, I think, is a much more, inclusive term.
Yeah, that's a great way to describe it. And, I remember, Merv, when we were first talking about the standard, and the question was, what do we call it? A standard on workplace mental health? And the answer was no, because when we talk about mental health, people immediately go to serious and persistent mental illness, like you just said. And so somebody said, I think it might have been Martin Shane, people will ask, what do you mean by psychological health and safety? And the decision was, that's a good thing. right?
Yep,
If they
yep.
don't, if they're not making assumptions, if they're not drawing conclusions, then it's something that's good. Now let's fast forward to today. And one of the things that you shared with me is the impact of COVID-19 on workplace psych health and safety. So can you share some of your thoughts around that?
Well, I still think we're finding that out, needless to say, and it's almost a trivial statement, COVID, and I have a couple things. First of all, I think it's important to distinguish between COVID, i.e. the the global pandemic and so on, and the symptoms and associated with it, and some of the restrictions and health restrictions and so on that quite appropriately various governments, including Canadian governments and provincial governments and so on, have put in place and so on. And we know about that, working from home and all those kind of things. Those things overlap. They're obviously related and so on, but they're somewhat different. And I think some of the, I'm a little loath to say restrictions. That sounds too punitive. I don't mean it, but the adjustments that people had to make have had more of an impact than the disease itself. Obviously, and much has been written and talked about the fact that people are working from home. Some literature coming out saying for people with white collar jobs who are able, like you and I right now, to be able to work from home and have a roof over our heads and have the time and the support to be able to do so. I won't say we're thriving, I won't say we're doing better, but it's a different thing from someone who is perhaps a frontline worker or working a food processing plant and laid off. So this is beyond psych health and safe, but it has disrupted the the workplace in many, many ways, still to be determined. I think it's going to be interesting to see what happens as people have returned to work and are returning to work. It will be intriguing the extent to which concerns and fears, if you will, around COVID and so on are going to impact the workplace. There was a fairly high profile situation here in Vancouver where a hospital worker, I believe if the person was in reception, was asked to come back to work and requested very strongly that a number of things were put in place for return to work, plexiglass around her work area and things like that. So there are going to be accommodations to deal with the anxiety and worry, justified or not, and so on, this can impact. And that's a whole new thing for employers. On the somewhat positive side, I read recently a very interesting paper by Maureen Dollard out of Australia, who's a leading researcher in this area, as you know. And she did a wonderful study when Australia got hit by COVID. And Dollard talks about a very good construct that kind of ties in very nicely with the psychological standard and factor and so on, psychological safety climate. So she has measures of that, definitions of that, so on. And she was looking at interventions with a number of Australian workplaces to see if it could enhance psychological safety climate. And she had, if you will, a control group, and she had a group in whom she was doing some training and consulting and so on with colleagues. And on they were going, and they were measuring differences and so on. And then COVID hit. And the expectation, well, I shouldn't say the expectation, but the expectation was probably that things were going to go bad. What she found in both the experimental, if you will, the treatment group and the control group, it actually enhanced her measures of psychological safety climate. It served as something of a catalyst. Now, I'm not saying that's universal, and I want to see that replicated, but it may be, people talk about disruption, disruptive technology, disruptive situations. Maybe COVID and the impact of COVID will have some positive impact. It's certainly brought to mind for employers, for sure, who are struggling to find people to work and so on, the importance of creating a workplace, a work environment where people do feel, well, safe, but also thrive, respected, listened to, so on. So I think, I don't want to say it's going to have a positive impact, but I think it's going to change things. And I think we're still determining how. I think that, quite frankly, I think, and we'll include guarding minds at work or any other measure we do of the current workplace, is going to be rather idiosyncratic for anything we do a couple of years ago up for the next couple of years going, because this is a unique time. So worth doing, but recognizing that the word normal gets overused, but these are not normal times.
Yeah, there's no comparison, right? To a direct comparison to what was going on 2 years ago and what would go on today. I think, Merv, a lot about the statistic that 8% of people may be going through a mental health issue like depression or anxiety. And today, 100% of employees have experienced loss and grief, loss of their routine, loss of a job, loss of a loved one, loss of, their freedom to do and live the way that they were used to. And it's so important for employers to be able to attract and retain talent right now that I think it's opened up many employers to being a great place to work. And you could do that by throwing lots of money at people, or you can do that by actually being a great place to work. And it almost feels like a bit of a gift to those of us in this area that there is more appreciation for it. But speak to me, Merv, about your thoughts. They call it the Great Reset, the Great Resignation, but I think many of us have re-examined our life, our values, what matters to us, and that in addition to the baby boomers finally retiring, I think this reimagining life has had a huge impact. What's your thoughts on that?
Oh, well, I think that's true, and it's a bit of a reckoning, if you will, in many degrees. On that note, and this is something else perhaps we'll talk about in Dan Bilsker when you talk to him, we have talked about this. We did some work with paramedics here in British Columbia some years ago. And we, amongst other things, we asked them what their work was like, what resilience looked like for them, what some of the stressors were. And based off all this information, quantitative, qualitative, we came up with a model, if you will. And to your point, some of the aspects of the model were exactly the things you would have expected: workload balance and so on, support, but interestingly, it was trusted support. So support from people you trusted and so on.
Mm.
We're exercise, diet, the things that make perfect sense, no argument there. But people also talked about the importance of meaningful work, their values and so on. And that's, quite frankly, if there's revisions in the standard or guarding minds of work or any tool, I think those kind of things, values, are going to matter a lot more. Is there congruence between the person's values and beliefs and the work they are doing? And it doesn't have to be 100%, but there has to be some synchrony there, I think, for everyone's sake, the employer and the employee. And the other thing we found important was, if you will, compassion fatigue, which is being talked about a lot now and so on. Is it a place where people are getting, and we see this in healthcare, obviously, getting burnt out? So does the workplace, does the work environment recognize the stresses and strains and the impact on the individuals? So I think it's shifting us. I do have a concern, back to your earlier point, and I'll be kind of blunt about this. I absolutely agree. If you're not feeling somewhat stressed or distressed during the current time, be it COVID or the many other global issues, so on, you're either dead, you're under a rock, or you're a psychopath. These are strange times. What it is, and I'll come back to our earlier conversation, this is indeed a classic kind of, if you will, psychosocial event. The response to this is not, let me hang up my phone. Sorry about that. The response to this is not the traditional response to psychiatric illness. This is not a call for more medications. And be very blunt about that. So I think our response to this should be psychological, should be social in that sense. And I hope it is. And I hope employers recognize that.
Yeah. Do you know, that's an interesting point you brought up, Merv. And I remember going to you many years ago to ask about a friend who was having issues. And you've talked before about the difference between when the issue is to be medicated and when it's not, in as plain language as you can, for those of us who aren't in the medical field. Can you talk a bit about why so much of psychological issues can't be medicated away?
Because the issue is existing in the person and in the world, the environment he or she is living in that sense. I'll be very blunt about this. I don't think there's any medication that I'm aware of you can give to deal with bullying, except perhaps arsenic given to the bully. But other than that and so on. So it's just,
you're not advising that.
I'm not
right,
advising
Merv?
that.
Okay,
I'm not, that's enough. But they're different arenas. They're very different arenas, and I won't go too far down this path, but the hardcore evidence for some of the biochemical models of, again, use that word mental illness, but include depression, anxiety, and so on, are sketchy, shall we say, and so on. So I think medications, and I'll knock this, certainly can provide some relief from stress, distress, certainly psychotic, distorted thinking, cognition. So there's absolutely a place. I don't want to knock that, but they are, well, again, clearly not a cure-all. You do need to deal again with giving the person, the individual, the skills, supports. That's where cognitive behavior therapy comes up and so on, and dealing in the environment in which they're working with. The metaphor, and it's the easy one I always thought about, is think of the canary in the coal mine to some extent. You need to put a hard hat on the canary as well as making sure there's no noxious gas in the coal mine.
Hmm. I often hear people who want to just take a pill and it's all better. And I often hear about leaders who just want somebody to go to their doctor and get a pill and then it's over. And the reality is there's work to be done in terms
Yep.
of relationships, in terms of work environments. And I don't fault anybody for wanting a quick fix, but when we understand the reality, we understand it's not there, that it takes more than that. And I think about the family members too, Merv, that, well, if I can just get them to go to the doctor, then everything would be fine. And it's a hard reality when you
Yep.
love somebody to realize you can't fix them.
Oh, indeed, indeed. And again, and I think that the physicians are equally hampered in this. That's what they have available to them. I can go another end. So, on the availability of good psychotherapy, so again, primarily CBT and so on, in Canada is limited. It comes back to our earlier point, and I think employers are getting more and more aware of this and are expanding benefits and the like to provide access to quality talk therapy, to use that general term. But what you raised is at a global level, and we've seen the government say, yes, we have a mental health crisis, and so on. But put it into action. Again, come back to history a little bit. I think one of the impetus for a lot of this area, frankly, was the Kirby report way back when, and I'm forgetting my year, where Kirby was, I think, one of the first, and there had been multiple commissions on healthcare, was the first one to really identify the workplace as an arena, an important arena for investigation and intervention. So I think in some ways that was sort of the start of things.
Yeah, the out of the shadows. Although I just had Steve Sproul from Husky, you've probably run into him, tell me that the very first Mental Health Awareness Week was, guess what year?
Don't know. 19.
1949.
Oh, wow. Really? Really?
Yeah, that sort of blew my mind. It was thinking about that there's some people who knew and were trying, but I remember when I was young that people would talk about somebody had a nervous breakdown at
Yep.
work. We didn't know that they had depression, anxiety, bipolar. They just had a nervous breakdown, and it was almost a badge of honor. Well, you worked so hard, you had a nervous breakdown. But we didn't, if somebody in the family had a mental illness. And I remember Karen Lieberman talking about this because she had very serious depression for 30 years and they just wouldn't have company over when she was not well. They just didn't talk about it, and it was a dirty family secret.
Yep.
And of course, when it's no longer a secret, now you can get help.
Yeah. And we do have to move from awareness to action. I do have a concern, and I see this in workplace context, other contexts. Well, let's build awareness, build awareness, build awareness. Okay, but I'll come back to my example. Some extent, if there is, I'm not wild about this phrase, but I'll use it, a toxic work environment in some fashion, being aware of the signs and symptoms of mental illness is not going to help, and frankly, I think could be counterproductive. I think it can potentially build up a sense of resentment and cynicism because the organization or the leaders are not doing anything.
Yeah, absolutely. So, Merv, what would be your advice if we did have a toxic workplace? What would be your advice on how to take action?
Well, that's a great question. I think there are multiple ways. First of all, dig in a little bit deeper to find out what that actually means. And various tools, guarding minds at work being done, and I think has the advantage of sort of breaking down what are the elements, what are the aspects of that workplace that seem to be leading to the problem. And that needs to include leaders at all levels and so on, because they are by no means exempt of that environment. And then look at issues like workload. Get input from employees. They have, well, I come back to my example with the BC paramedics and so on. They have experience and, if you will, lived experience that other outsiders, consultants or experts or researchers don't have. So listen, take that information, start small, start realistic. In some ways, you're not going to fix the world overnight. If the organization needs to do some radical kind of things and so on, including disciplinary kind of things, go for it. I think there's, well, again, in British Columbia, and I don't know about the other provinces, you can perhaps tell me, has so-called bullying and harassment legislation since 2013, I believe. The regulatory stick can help, and regulatory stick requires an organization to have a policy in place, a process for investigation, a process for reporting, and the like. It's a little thin on the ground in what you then do about it. But there have been some programs, and there is a very good program. Michael Leiter out of, where was he? Was at St. Mary's, I believe. But anyway, led a program called CREW, Civility, Respect. I forget the E and the W and so on, but he has done some trials. He's actually done some good research on these interventions where there are educational training sessions about how people can treat one another and should be treating one another. Now that's useful. Again, I come back to the point, again, we use the word toxic workplace, if there are other factors there, and workload or manageable workload, more importantly, might be one of them, you got to address that stuff too. So ideally, I think interventions should involve an organizational intervention at that level, but also providing an opportunity for the people who work there to have the knowledge and skills to self-care, self-manage, and care for one another.
And I think it's such a great point, Merv, because I know with WorkSafe BC, as well as with WSIB, which is
Yep.
the workers' comp here in Ontario, they both said that the majority of claims for bullying get denied because you can't prove malicious intent. And so it made me start to think, well, if the issue is I didn't mean to, then it's that we're not aware. And so we started to look at, never mind teaching about bullying, because we all know it's bad. Let's start teaching about psychologically safe interventions. And we do that by thinking about the unintended consequences of what we say and what we do. And then we think about the assumptions that we make about what other people say and do. And I recall a time where I was burned out and I just believed everybody was out to get me. So you could have said the most innocuous thing and I would have thought it was an insult or something. And then we teach about moral courage, which is that ability to respectfully intervene, not say, how dare you, but be able to say, are you having a rough day or do you want to take this offline? So yeah, I think we've got a ways to go to actually change the behaviors that create bullying, and teaching, like you said, awareness, this is bullying. It doesn't really help. It doesn't really change the behavior.
No, I don't think so. And the work that, well, you and your colleagues have done, and then so on, and workplace strategies and other places and so on, about that conversation are a great example of that. And I think, and they reflect, I think back to stuff I used to do with kids, and we should do more with adults, which is assertiveness training, distinguishing between aggressive talk or behavior and so on, passive talk or behavior, and assertive behavior, being clear, communication, being respectful, and so on, but also with some accountability. And those are skills, and we could all use them in various degrees and so on. And particularly under times of stress or distress, they get pared away.
It's brilliant and an important point. Can you expand on it a little bit? If you were in the workplace and you were teaching that particular set of skills, what might you be teaching? What might you be helping people to understand?
Well, Very much, again, what you said, and so on. I talk about how communications are expressed, how the nonverbal and verbal aspects of things, how important language is. That's again, I don't want to use the word respectful, but it's clear is actually language that makes the point, and so on, and being sensitive to phrases or humor and so on that may be perceived or experienced differently, and so on. Paying attention again to nonverbal cues, setting the stage for for our discussions and conversations, so it's not coming out of the blue. Picking timing, respecting privacy and confidentiality in those conversations. Doing role playing. What I've done training in the past, yes, we can role play how to again have a conversation, a discussion, so on. But I also think it's kind of fun to role play doing it badly in that sense, and then what went wrong or what could have fixed there, and so on, and to encourage folks to practice or practice in their own lives and practice with one another.
Yeah. Yeah. I think it's a missing issue. I was in one workplace and they had taught respect in the workplace training 3 times in 1 year, trying
Yep.
to change behaviors, and it's not working. You
Yep. Yep.
need
Yes.
another approach. And talking about approaches, Merv, you talk and write about evaluating the action. So we can go after something that we think is going to make a difference. We can go after the flavor of the month, but how do we know that it's having the impact that we wanted it to have?
Well, great question and great challenge, quite frankly. Most of the indicators that we track and that standard talks about, and we've looked at our so-called trailing indicators. They're things after the fact: disability rate, EAP utilization, length of time off work, those kind of things. Well, the horses have left the barn at that point. So what we need and to work on are, if you will, leading indicators, and you get those may well be qualitative. You're going to get those from individuals in the workplace themselves. Maybe interviews, it may be focus groups. Those kind of things can be helpful. I know it's interesting. I don't see this as much at all, but when there was the initial interest in the standard in psychological safety, often made, I think, unrealistic claims about the financial benefits, so on. If if you do these things, you'll see a 10-time return on investment. As my colleague Kevin Kellaway pointed out, if that was actually true, that all these businesses would just be in the psychological health and safety business, because it's a great business to be in. So I think we need to be modest. And on that note, I'm getting slightly off track, but I think I will go back to the case study project, which, just to remind folks, was the study that colleagues and I, following a bunch of organizations to implement the standard. The main reasons these organizations, these leaders got into it was just because it made good common sense. It was just the right thing to do. There was an ethical thing, but it just I don't want to say happy, but a psychological health workplace is a better place to work, and that shows up in sustainability and perhaps profit, if that's your key motive. But finding other measures and other indices and so on that can be used unobtrusively. It's important to remember that using a tool, well, again, we'll use Guarding Minds as an example, is not just benign, if you will. It's actually a bit of a call for action, because if you're asking people about things, there's an expectation, quite justifiably, that you can do something about it. You can A, tell them what the results were, and B, you're going to do something about it.
So we have a phrase that we use called rush to survey.
Okay.
Which is saying if you rush to it without having a plan in place,
Yep.
then you can increase cynicism and skepticism, because if I get asked my opinion several times and it's never taken into account, I don't want to give my opinion anymore. What are some of the things that you would tell an organization to do immediately upon finishing the survey, even before they've been able to analyze the results?
I'll start when you made a very good point. I'll start with that. Think ahead, what you're going to do, how you're going to do it, how you're going to communicate it to it. Follow up from doing a survey and so on, saying the results we are being analyzed and we will share these with you. So you need to communicate honestly, warts and all. One thing I'm pleased with, and it gets a little bit lost, when we initially developed Guarding Minds at Work back in way back then, whenever it was, 2009, I believe, so on. We intentionally framed it in a positive way. We used our items on our descriptions of the dimensions or factors were phrased positively. So it was intended to point out strengths as well. So I think one thing, and answer your question, there will be strengths. Inevitably, it seems that engagement comes out as a strength. Great. Talk about the things that are positive as well. Talk about the stuff that isn't doing as well and so on. And again, but my earlier point, don't stop there. Look for initial successes. Get people together, talk about results, and look at their input. I remember some work I did way back at the early times, actually, with Great West Life at that time and so on, who had run the survey. And I went and met with a couple of offices when they were discussing the results. And when they were talking about it, they came up with some brilliant ideas, which I'd never thought of. I was outside the organization in terms of things I could do. One example was if there was an opportunity to job shadow somebody else, they knew where there were opportunities for development or career change and like. So listen to people.
Yeah. And do you know whether you're talking about the standard or just good business practice? And you keep saying it in different ways, Merv, but you keep saying, listen to the people.
Yep.
And when I'm asked about psych health and safety and implementing the standard and going through all that, I say, you can really distill it down to listen to your freaking employees.
Yep.
And yeah, I don't always say it that way, but it is the point, right? Is if we really listened, then that could create psychological health and safety in and of itself. All of the other structures and tools and resources are to help, but it's to help you to listen to your employees is really what it is.
We recently, Dr. Bilsker and I recently had an opportunity to put together a proposal in an academic setting, a particular academic department. I won't use any names because it didn't happen. What they had, not horrible issues, but they had some issues that are somewhat endemic in places like hierarchical organizations, like academic organizations, frankly, hospitals and the military. And we're seeing the impact of that all over the place now. And there were concerns about workload. There was concerns about fairness and equity, about recognition, the kind of stuff one would expect. What we proposed to them was use some tools we had developed, a thing called the Measure of Organizational for Readiness for Psychological Health, to facilitate that conversation amongst themselves. The point that many of you are managing some of these things. Have you talked with one another? You sharing those? Create an opportunity to have that discussion. They didn't want to do that. They wanted, I think, us to come in and fix it. And I said, we can't. Some of the stuff is structural and a lot of stuff is internal. You need to learn from one another and so on, and take that forward.
Yeah, and it's very similar to dealing with a mental health issues. You have to do the work. Well, dealing with a workplace issue, you have to do the work.
Yeah.
And I've gotten to the point where when someone says, I just want you to come in and fix it, I say, yeah, no, not interested, because if they're not committed to it, it's not going to be sustainable. So there's no point in getting involved. Yeah. Other ideas around where we should go from here in terms.
Lots of ideas for sure. One thing we're doing, again, Dr. Bilsker and I are doing currently, which is kind of neat, is for a umbrella safety organization for manufacturing and food processing out here in British Columbia. Good people, and to their credit, they have made mental health, psychological health a key platform in their strategic plan. And that's particularly admirable because this is one sector that are late bloomers in this area, shall we say. Well, if I go back to the case study research project, we didn't have people from that sector. We didn't have people from retail. I don't think we had anybody from the hospitality industry. So this is a sector where this is going to be a bit of a harder sell, but they're taking it on. However, one of the issues is, and it's an issue for many employers, so on, over time, since this area of psychological safety has emerged, there are more and more tools and resources, many of which you and your colleagues are providing, the commission are providing, we're doing work. And so there's more stuff out there. There's also consultants and firms recognizing this as well. So there's lots of stuff out there, and it's stuff of varying quality and relevance. So what we're doing for them, and I'd love to see this expanded in other ways, is creating, and we're calling it a rubric or a teaching or decision-making tool. So we're using some criteria, some quality criteria and so on, that can be used and applied to a resource in terms of its relevance to a particular problem, to its applicable and relevance to some of the elements of the standard, relevance to various factors, whether it's relevant for small organization, whether it's relevant for that sector, what the cost effectiveness is, whether it requires professional training or input for a small organization with employees in various settings. Having a training workshop in Vancouver, for example, is financially and practically logistically impossible. So this is going to be a decision-making tool, and some folks within this association are going to use this tool, and we're trialing it as we speak, to see, to run some tools through it and so on, and give it a Yelp review, if you will, or a Consumers Reports review, so on. Because I really do think that one's important. I think, again, and I'm sure you've heard this as well, players say, okay, I get it, but now what do I do? And this will help with decision making. I really do. So I think we need to start, I say not winnowing, but providing some categories and some guidance that can be provided to employers and labor and employees and so on to help differentiate some of the stuff that's out there.
Yeah, that's great, because it is overwhelming. There's so much available, but not everybody has the confidence or the competence to use it.
Right.
And they don't always know where to start, right? There's just too many options, and you can get paralyzed by worrying that you're going to do the wrong thing.
And
So,
for sure. And back to our earlier point, to some extent, what again we've found in the case study project, I think will still be the case today. A number of organizations with good intentions will say, great, we'll run a mental health awareness program, so on. And again, I'm not knocking that per se, but I will repeat my point, so on. If your issue is bullying or workload or burnout and so on, I don't think that's going to be particularly helpful and so on. So again, I think players saying, and saying this, now I've done something. It's worth remembering that the cost, sort of, if you will, not just financial, but the kind of cost and impact of an intervention can also be negative. There's an opportunity cost there. If you're doing this, you say, great, wash my hands, I've done something, but you haven't done that, and so on.
yeah.
And there's some interventions that can actually do harm. Frankly, critical incident stress management, the way it's certainly when mandatorily required and so on, there's a growing literature that can actually be harmful.
Yeah. And can you explain to the listeners why that is?
Yeah, a couple of reasons, I think. Certainly the way when it was originally developed, it was a very rigidly structured. You're supposed to do this, this, and this. It was encouraged to be mandatory for people. Encouraged. It was likely mandatory. Came out of, I think, the military model. It might have been first responders. I don't remember, and so on. So it was a mandatory participation kind of thing. They overstated sort of the hush hush quality of the whole thing in some ways. So it either traumatized folks in various ways or re-traumatized, and I've done small debriefings a lot through my career and so on. I think support and provide information and provide support unquestionably and so on. But I think that's sort of the key function. I also, for folks who said, gosh, I'm not feeling any of those signs or symptoms, I'm okay. I must be a bad person because I'm not broken down. So there's a lot of unintended consequences that can occur.
Yeah. And I think that's the thing, is that they're not always thinking it through. There may be great intentions, but it's thinking it through in a way that's healthy. Any other points or tips that you want to share today, Merv? I've got another question for you before we finish, but is there anything else you want to share with the folks?
Well, a little bit. We've kind of touched on this as well. I think it's important that interventions or actions be customized. And I'm sort of repeating myself, not just things off the shelf and so on, but they actually need to fit the particular needs and characteristics of an organization and so on. So that customization piece hopefully provides a better fit, a boutique kind of intervention, if you will, and also is much, much, much more likely to be picked up. One of the challenges, and again, we've seen that in research and so on, and we see this in government policy and everything else, is sustainability. So build in and think about sustainability as much as you can. The standard has that as a kind of final element, but it feels to me a little bit like an add-on. There's very little guidance on how to keep things sustainable in some ways. And that certainly does take leadership. It takes evaluation. It takes a willingness to say, this isn't working. What can we change? Or this is working. How can we expand it and make it bigger and so on? So have that active engagement. That often occurs when, WorkSafe BC has now appointed a chief mental health officer. There's that mental health word, but nonetheless, they're actually creating positions. I know more and more OH&S health and safety committees and health and safety organizations and so on are recognizing psychological health. Let's get back to history a little bit, but the point you were making earlier, we will recall in some of the early discussions and so on, an argument was made, and it's a reasonable argument and sort of World Health Organization argument, that psychological health or mental health is part of a whole definition of health, global health in some ways. And I argued then, and I would still argue, that psychological health is still relatively new, psychological health and safety, and it needs its own space. And maybe that wonderful day will come when we can take off the training wheels and so on. But at this point, I think we need to do and are paying attention to this as a somewhat unique area.
Mm-hmm. Well, and I think Maureen Shaw said that one day. She said, sometimes we have to take an issue that people are ignoring or don't understand, and we have to segregate it before we integrate it back in so that they can learn what it is, what's missing, what's different. And I think that's what you're saying as well. And, Merv, I've been talking all year about that psychological health and safety can't be policies and programs.
Right.
It has to be how we treat each other at work. It has to be part of our day-to-day routine in terms of the way we do business. And I think that aligns with what you're saying, which is it has to be customized, has to be part of your business, not 1 hour lunch and learn that you think is going to change everything going forward. Nothing against the lunch and learn. Sometimes they're a great experience, but it's not enough.
It depends on the lunch.
Good point. Okay, so here's the final question for you, and that is, if you were describing what it feels like to be in a psychologically healthy and safe workplace to somebody who has no idea what we're talking about, how would you describe it?
It's a place where, as a person who works there, a client or a customer, you get a vibe, and I can only describe it that way, sense that people want to be there, that people enjoy it, and they're not saying, thank you, ma'am, because they were told to do that in their last performance review and so on, but they actually mean it and they actually care, and people are connected and so on. And their work matters to them. They feel proud of their work. It's a place where people are able to be their best, be cliched, but actually achieve things and feel good about what they do and to serve others. I read, let's see if I can remember this. I read an interesting book the other day by Alain de Botton, who's a philosopher, was actually the philosopher in residence at Heathrow Airport many years ago and so on. And I forget the name of the book, but he talks a lot about work. And his simple definition of good work is either something that brings not pleasure, but satisfaction, gives to people and so on, or relieves suffering as kind of core components of good work. Brief story, if I may, of what I think does, well, it was a wonderful success. Years ago, I was part of the American Psychological Association's Healthy Workplace Awards. One of the places in British Columbia that got an award was a care center for the elderly and also brain injured adults and so on. They had a staffing issue, no big surprise. They relied on, again, like health does, they relied on calling in retired nurses, we'll say, or other staff and so on, which is a real issue when they're to sort of handle their workload. This was a challenge when there were school holidays because many were single moms or they wanted to be home because their kids home and so on. So they had a real hard time with staffing. One of the staff, as I recall, it was a recreational therapist, said, here's an idea. Why don't we set up a program where we can bring kids to work, not as a daycare. They're brought in and they were paired up with senior. The unit is called Brookhaven. It still exists to this day. They deserve the credit. And they brought, so imagine Nancy's a nurse. She's a single mom. Billy, her 12-year-old, is home for the day because it's a school break or whatever the case may be. She brings him into work. He's paired up with a resident. And let's say he's paired up with Fred, who's, I don't know, Afghani war veteran with one leg, and he and Billy hang out and maybe he tells him gross stories, whatever the case may be. Nancy can see what her kid's doing. They all have lunch together. Everybody benefits in that sense. It costs nothing and so on. They saw people lining up to work on those days. This part was particularly cool. I wanted to see if the program was still happening, and found out, called them up fairly recently, many years later, and said, yes, the program is still happening. And some of the kids who were in this program had aged out and had on their own as teens created kind of volunteer program. And in addition, the woman I spoke to at Brookhaven said some of those teens at that point had gone into healthcare and now worked at that organization. That to me says a lot. That's a kind of continuity and frankly of a healthy workplace, doing hard work, doing difficult work.
Yeah, but in a way that is meaningful,
Yeah.
in a way that's sustainable, and a way that is psychologically safe.
Yep.
So yeah, lots of value there. Merv, if somebody wanted to get in touch with you to consult with you on psychological health and safety or any of these things, how would they get in touch with you?
Our website, a little clumsy and outdated, but it's there, Vancouver Psych Safety Consulting and so on, or my email, which is, and this may come up later, it's Merv, M-E-R-V, at psychsafety.org. So either way, and I'd be happy to talk to anyone.
That's great. So thank you very much for joining me here today and talking psych safety. You will see there will be clips on LinkedIn, both the Flourish DX LinkedIn and my own, and the full podcast will be at Psych Health and Safety Canada.com. Okay. Yeah, that's where it'll be. So thanks again.
Thanks, Marianne. Great to see you, and thanks for having me.
You've been listening to the Psych Health and Safety Canada podcast. To stay up to date with the best content on workplace mental health in North America, subscribe wherever you listen to podcasts and join the Flourish DX community at www.flourishdx.com.